Hello and welcome to Filibusters in Fine Print, where AMGA's public policy team gives you the insider view on healthcare regulations and legislation. Thanks so much for joining us for the latest from Washington, D.C.
Good afternoon, and welcome to AMJ's Filibuster and Fine Print podcast. Right now, we're going to do the fine print part of our podcast, which is all about regulatory affairs. And I'm very proud to but to welcome.
Hi, everybody. My name is Daryl Drebna. I'm the Senior Director of Regulatory Affairs here at MGA.
Good for you.
Yeah.
I'm Jamie Meller, Senior Director of Government Relations. So I do more lobbying of the Hill. And when Daryl and I talk and do things, he makes me feel stupid because he knows the details of the things. And then I realize when he meets my Hill people that I talk to, then I realize I'm really smart in your eyes.
That's going a bit far, but we'll continue on.
That's a whole other podcast right there.
We made eye contact when I said it was a very personal situation.
And I am Chet Speed, and I am your host today of whatever this is. So, all right, well, let's get to the matter at hand. So Daryl, our smart one, and I won't tell the Davidson people about you, your comments.
Yeah.
The Trump administration begins 2.0 on January 20. Let's talk about some of the potential leaders over at HHS and CMS.
Sure. So President-elect Trump has indicated he already has nominated or is about to nominate RFK Jr. for HHS Secretary.
Not controversial.
No, everyone seems to be entirely cool with this. There was, I think, about 15,000 doctors signed a letter and sent it off to the Hill saying they were adamantly opposed to this. So,
okay.
starting off strong with RFK Jr. at the top of HHS.
All right. So what's the big controversy? And assuming he makes it, what are some of his priority issues?
Sure. So I think there are like 4 or 5 things that he wants to focus on, and some of them, they definitely fall under healthcare, but not what AMGA members or us as a policy team have really focused on. Food nutrition is his big thing. He talks a lot about unhealthy foods, and he thinks he can improve chronic disease in this country, improve obesity rates in this country just by having better food and exercise habits, that sort of thing.
So no more Subway.
No more Subways, right?
Okay, that's
yeah. Chronic disease. Again, this is getting back to that food nutrition. He's been butting heads with the pharmaceutical industry essentially his entire career. So where he sees this as not so much something that can be treated through traditional medicine or pharmaceutical interventions, it's lifestyle changes for him. And then you get into other aspects, things he's pushed out, like, we've got fluoride in the water. That's something he's opposed to. So.
I'm a Colgate grad. Is that a problem?
I don't know. This is where it gets a little squirrely, and when you spend your career buried in Medicare regs, and all of a sudden HHS is talking about like maybe we need to go back and not put fluoride in the water. It's like, oh, okay, this is going to be a very different administration.
Absolutely.
So yeah, that's kind of where we are right now.
And not big on vaccines.
Correct.
Candidates.
That's another thing that falls under that. Where he definitely looks at the pharmaceutical industry as an entirely profit-driven enterprise that is interested in essentially keeping people sick so they keep buying your product, right? It's not a healthcare or a wellness type enterprise. It's we need you on our products and keeping buying that. So it's a very different, almost like anti-corporate approach to healthcare regulation or a healthcare viewpoint, which is really interesting coming from a Republican administration, which historically has been, really pro-business. So how that fits in with the rest of President Trump's selections is really going to make for some interesting cabinet discussions, I think.
I would just say with RFK, it's complicated politically because he's not a Republican. He's not a Democrat. What is his constituency? You have the Senate Health Committee, Health, Education, Labor, and Pensions Committee, Dr. Bill Cassidy, who's like, I don't know how I feel about this. He's Republican. You need 60 people to support him to get him passed. We don't even know if we're going to get him out of the committee. So we'll find out late, January. But I think there's some political perspective beyond the things that he's saying about fluoride and vaccines and What is the Maha Caucus, Make America Healthy Again? He ran as an independent, so
Right.
these senators owe him nothing, and that's problematic if you need 60 of them to support you.
You need votes.
Mhm.
You need votes to get across.
Good point. Any place where you see, assuming he does make it through, where AMGA can work with him?
Yeah, it'll be interesting to see. So, the Biden administration pushed out this Medicare Advantage proposed rule. It's going to have to go final under the Trump administration. So, there was a lot in that reg about two things I think will be interesting to see. First off, and this gets back into his public health realm, and Medicare, the Biden administration proposed sort of redefining what sort of drugs they can cover to address obesity, specifically the GLP-1s, right? Yeah, RFK Jr. has been a vocal critic of those, so I expect they're going to take a hard look on whether that gets finalized or not. So that'll be interesting. But I know, chronic disease and obesity is a huge issue for our members. They're very focused on addressing that. We've got collaboratives here with AMGA that focus on that. So I'm cautiously optimistic we can get in and talk to those career officials at CMS and say this is a welcome change to treat chronic disease. The other one, this will be really interesting. The same proposed rule I'm talking about has a lot about prior authorization and reporting, that sort of thing. So we were fairly critical of earlier rulemaking where it talked about the time frames for how quickly a plan would have to respond to a prior authorization request. And now you're in this whole different environment there's a whole lot of scrutiny of, insurance plans in that industry, right?
There's a lot.
Yeah, it's been in the news a lot. And how, if there's an opportunity for us to get our message across, like here's how we think prior authorization can be approved. Here are the pain points that our members talk about with prior authorization. I think we might find a little bit more receptive audience under an RFK Jr. HHS.
And interesting. Jamie, you have a thought?
Yeah, I was just curious because the first Trump administration, the administrator was a former congressman, and then it was a former HHS general counsel who was a Supreme Court clerk, who worked in the government, understands the government, knows how to do things. How is that different from what may be happening January 20th, where the new people have never worked in
They
government
are
capacity?
in for a world of hurts. In a previous podcast, we talked about how it's like an internet Congress and it's super, super fast. And, maybe if we went back to dial-up, it would slow things down, make things easier. The federal bureaucracy is not even on dial-up. We're like movable type. It's
used to be one.
Oh, I used to be one.
Yeah, he knows.
So it's like if you're coming and these are guys who are used to move fast and break things, right? That's that Silicon Valley mentality, right? That is not how the federal bureaucracy works. They have their rules and regulations in place. Like we put out this rule, it's got to have a 60-day comment period, and you got to cross every T, dot every I, and then it's got to go through general counsel's office, and then if it's a special Tuesday, you have to do this. It's this whole special thing. They have no knowledge of this, right? And they're going to get educated very quickly on what you can and can't do when you're managing any of these federal agencies, CMS in particular, or HHS as a department. You can't just go in there willy-nilly and do whatever it is that you want to do, because there's a whole lot of career civil servants who are going to say like, okay, we can attempt to do this. Here are the 18-point checklist that's going to take months, if not years, to stand up. So that's going to how that comes to a head and what the reaction from the folks at the top, and if they're trying to use their internet, Twitter or their avenues that they're used to amplifying their message, how that affects the federal bureaucracy is going to be very different than how it affects members of Congress, I think.
That is a very good point. Yeah. We mentioned CMS. We have a doctor candidate for the first time ever, I believe, right?
First medical doctor. He's
Well,
got
that's
a
what
bunch
I
of
mean. Are there other
PhDs.
types?
Yeah. I think I just stepped in it without remembering. So yeah, Dr. Oz is a cardiologist, if I remember it correctly, and he's also a TV personality. So he got his start on the Oprah Winfrey Show and
America's Doctor.
America's
He
Doctor,
might be a
right?
surgeon too.
Cardiothoracic
Oh, that's right,
surgeon.
cardiothoracic
Yeah.
surgeon. So
He,
yeah.
he just says, "I'm a surgeon." They always they start with that.
I start with that, yeah. So again, like here is essentially CMS. It lives in HHS, but really it's a programming and computer agency, right? They're dealing with data and coding and payments and all that. Now, obviously, there are policies and there are folks over there who are trying to improve the Medicare program, improve Medicaid program. They administer the Affordable Care Act and that sort of thing. Um, but it's going to be interesting to see how someone with a TV background is coming from a surgeon's office again runs up against that bureaucracy.
They like fast things.
They do, and
Correct.
again, this is not how CMS operates. For a host of reasons. That said, certainly he'll be able to put his stamp on the agency, and his big ticket item. No one really knows what exactly is motivating him outside of some articles he ran a couple of years ago, talking about Medicare Advantage for all. That was his big thing. So, and that we've got someone at CMS who is all in on Medicare Advantage, and you've got someone at the top of the department potentially who is not. So yeah.
So did he also ran for the Senate 2 years ago? Lost. Didn't really live in Pennsylvania per se, but that's so he definitely's had his eyes on Washington for a while.
Right. So, but it's interesting, like why I can see you running for Senate. There's a whole different animal than running. And say you get elected to Senate, and you're one of 50 over there, and then you're running
100.
this. Whoops.
And that is why he does regs.
Yeah. Yeah. 50 states. I got that right.
They're not appointed anymore.
Yeah.
To run for election.
Oh yeah.
They changed that
a
rule.
while ago. Yeah. 100 senators, 50 states. Until who knows what happens. What was your question?
I might have one for Jamie.
Yeah.
So, Jamie, you talked about RFK Jr.'s possibilities around his candidacy or nomination. How about Dr. Oz? Plus, minus, about the same?
I would say he has more of a chance because he has a constituency. I think he's definitely going to get the Republicans to vote for him. So the Republicans who are in Congress will vote for him, which means that there'll probably be 8 or 9 that cross the aisle to allow him, because he at least was a candidate, and the Republican Party supported him, and I think he was supported by Trump as well in his candidacy. So I think he's got RFK is too, but I'm saying that like he's been on the mind of like these senators for at least 2 years. They know who he is. Now they don't know who RFK is, but like they know what he stands for, and they know how to run the traps. I think RFK is a little more complicated. Is you don't know what you don't know, and it can things come up about bears.
He does not like bears. He doesn't like bears.
Things like that, and
Nope.
So he doesn't have the relationship that even superficially that Dr.
Well, he hasn't.
Oz has.
Yeah, and he hasn't been vet. I mean, RFK hasn't really been vetted. I mean, Oz has been vetted to an extent. Yeah. So we'll just have to see. I mean, I think he'll get called out for things he's endorsed with with Medicare Advantage plans. He's also endorsed a lot of dietary supplements and some other things, but that's a lot easier. If I was working on his confirmation process, I can defend that better than saying I don't want fluoride or I don't want vaccines or something like that.
Yeah.
So I think whoever's ushering him through the Senate, that's gonna be an easier one to get done than
Easier lift
Easier
for
lift.
Dr. Oz.
yeah.
All right, and good to know. Sorry, Joel.
No. I was just it's so fascinating to me that here are these guys who have these big picture ideas on really how to reshape healthcare in American society. We're going to make America healthy again, and then you're going to run this agency that is so in the minutia. Typically an HH secretary lasts about 2 years before they move on. Like I just, how frustrated, assuming he gets put into office, how frustrated is he going to get, and how fast is that going to happen?
We might find out.
Yeah.
And before we close, I did not mention that Elise is with us also. And we're going to, every podcast we do, we're going to talk about engagement with AMGA. And obviously, regs, you have your own policy committee that helps you with the reg writing, et cetera.
Yeah.
But Alicia, how do you engage with AMGA?
Yeah, so we have a few ways to get involved. We have our district advocacy program, which connects you with your member of Congress and their staff for virtual meetings. Lauren Latney runs that program. And then we have our grassroots network, which connects you with your office for a write-in campaign, and we send out alerts for that as well. And then we have later opportunities throughout the year.
Well, thank you very much. Fantastic. Gentlemen, anything else?
It's going to be a fascinating year. It's going to, I think, speed up, slow down, speed up, slow down. So we'll have to see what happens.
Great. Jamie?
Just pay attention. We'll be reaching out to all of you because there's a lot going on, as you said. The devil's in the details. So
Yeah.
All right.
100 senators, 50 states.
Good job.
Yeah.
Good job, Joe.
Yeah.
All right. Skibbity Riz. Thank you.
Thanks for joining us for Filibusters in Fine Print. This podcast was brought to you by AMGA. For more information about AMGA's advocacy efforts, visit amga.org/advocacy.